Good morning, afternoon, evening, night, depending on where you find yourself in the globe. This is Kingdom Economic Forum. This is a forum that has been established to look at the root cause of problems in our society and then provide solution from the Kingdom of God perspective. We do this together with the new African concept. With me in the studio is Dr. Joshua Pons Safo. I hope everything is right.
Very well.
How is the celebration going? The new African concept 5-year celebration.
Yes. I mean, so far it's been good. It's been interesting as well and very engaging. And then we are warming ourselves for the major activities, especially from August. August through to December, we'll be having a number of them. But so far it's been very good.
Once again, we want to thank those who are sponsoring the new African concept. One, which is 1,000, but two, which is 10,000. So your support is helping New African Concept to raise more young men because we see a new tomorrow. Over the period, we are looking at Ghana Wellbeing Index. We believe that there should be a new measurement that tracks what matters for human flourishing in Ghana, not just in Ghana, in Africa, not just economic output. And we said the core principle behind Ghana Wellbeing Index is that what gets measured gets managed. And what gets managed reflects what
we value.
So all you see around us and all the indicators we are measuring is because of what we value. So if you are not interested in the measurement you are getting, all you need to do is check your value system. What do you value? What do you want to measure? And we have said the solution we are bringing is not only government. We have mentioned all the stakeholders that can implement all these Ghana Wellbeing Index. Government, traditional authorities, faith-based organizations, private sector, civil society, media, academia, international partners, and then household. If you're your household, you can come out. You have to measure the well-being index of your children, the well-being index of your community, the well-being index of... This is amazing. You know, that's why I like the kingdom of God, the system within the kingdom of God. It's not one way. It's just, it cut across every segment. Everybody has a responsibility within. And last week, we started with one. In fact, we have mentioned about 9 of the domains that measured Ghana's well-being index. And last week, we started with one. That was the health. Within the health, we said we don't need to just measure healthcare.
Yes.
We want to measure peace of mind. We took you through the reasons we need to measure for each institution within government, within private sector, traditional authority, why we need to measure peace of mind. And then we told you the advantages, and your guess is mine. You realize that in fact, it's really true that say, if the mind is right, all other interventions, you see result. But if the mind, there's no peace of mind, if you ask the person 1 + 1, he will tell you 1,005. Because the peace, he doesn't have peace of mind. Stress level is too high, affecting everything. But today we said, because it's a policy position we are presenting to the academia, the government, the traditional authority, all the sectors, all the institutions, we said that no, we need to look at how we measure them. And then we are not blind that it's not, we don't have risks in measuring.
Challenges,
The challenges are there. In fact, the reason why you are alive is to solve problems. The challenges are bred for us. So when you are doing something and there are challenges, that should not make you stop. So when you see challenge, it means that you have to increase your capacity. Upgrade it. All that you need to do is to upgrade, not to abandon. Upgrade, not abandon the challenge that you see. So, Doug, oh yes, you told us last week. I think I was trying to summarize. I don't know whether I was able to do it right, but then the floor is yours.
Yes, I think that was a good summary. The fact that at least we listed The reason, I think maybe the place we did not touch on a bit was the household.
The household.
The household.
Yeah, the household.
Yes, with regards to the why.
The why.
But at least it's an extension of all what has been said.
But make a statement around it.
Yeah, so definitely when it comes to the household, in terms of even at the family level, now it is the single unit or the smallest unit of every society is the family.
If you baby, are you
the smallest unit, as we know, maybe in chemistry, the atom. Yes, so the smallest unit of every society, or even no matter how big it may be, even the nation, is the family. So it means that if the family is well situated, then it will have rippling effect, because it is out of the family that they will go to the work, they will go to church, they will go to everywhere that they'll be engaging. Yeah, so here too, it is so important because when there is a mental distress, it is going to affect
the family,
the quality of the marriage, the quality of the family. If parents are stressed, it will reflect on the children. They are tired. And then it will also affect their. In fact, the home. I think that we should be giving serious attention to the household.
Yeah, the household. Yeah, you're right.
Because the home is the first school of the child. The home is the first church of the child.
Don't outsource the home. The home, don't outsource to the church, to the school. The home is
the first school, is the first church, is the first training center.
The first citizenship mentality.
Everything is formulated there.
Yeah.
So it means that literally almost all the points we gave last week
is for the home.
Ultimately centers, or let's say the springboard is
the foundation,
the
root. Is the home.
Root is the home. So it means that the mental health. So it means that parents should not just be looking at the presence or absence of disease alone. And say, oh, my children are healthy.
Yeah.
And what is your metric? Your metric is that, they are not taking any medications.
Yeah.
And I say, and I say he's not vomiting until he's healthy. When you get close, when you ask the child, then you realize that because of the tension between the mother and father, it is affecting
the mindset.
This thing is so beautiful.
The child has become bullied in the school because of what?
So the child is not healthy, though he is not having diarrhea or malaria, but because of the tension going on between the mom and the dad.
Yeah.
Now, even the child can become obsessively, withdrawn as a result of, because Okami be an inti oyare.
Yeah.
Do onyare. So this thing is so beautiful. Wow. It's so beautiful.
So from what Doug is telling us, if there's any individual who will promote this health, peace of mind as a criteria, is the family. Yeah. In fact, the government should even institute a system where we would trace to families and give them tax relief because of the peace of mind in that family.
That's right.
That's another metric
that
we need to look at. A family that have peace of mind, they are producing
real citizens.
If the family has a peace of mind, they won't produce leaders who are corrupt. I'm telling you. But because there's no peace of mind, the right value system are being taught, about friend where you free. Any other politician. Anyway.
This is massive. No, this is
serious.
This is serious.
And you will not get this from anywhere except from Kingdom Economy Forum.
It is seriously massive.
And I told you that what we're going to say, we're going to be brutal and of fascinating crew. This. And you gave a very good his uncle, the moon, and then of us uncle. Listen to me.
My uncle leave me, my uncle.
we need to become concerned, like Doug was telling us, the fact that if there's no peace, the rampant divorce is the peace of mind that is not in the family.
Yes.
Yeah, and these people are based on to divorce. There's no peace because and because the man is sick mentally, is not stable, and we anyway. We will come to that.
Yes, we'll definitely come to that.
So now we are looking at the strategies.
Yes. So we'll also go by the same formula because each institution has peculiarities.
That's the point.
Yeah. So starting with the government, what we are proposing is that in the forms that do measure other things, we propose like the district health information management system.
Yeah.
It is something which is already there. Yeah. Yes, we can add another parameter which can be the peace of mind question. So we could tease out and frame some question or two that brings out the measurement of the peace of mind of the of the people within the communities, or when they come to the hospitals, or even when we go community health care.
Okay, sure.
Yes, moving from one household to the other, we can be measuring some of these things. Yes, or maybe on a quarterly basis.
Yeah.
These things we are making mention, including the family we just made mention. In fact, if it is well explored and exploited, we will realize that a Juma sem enye an issue. We'll be able to quench the fires of unemployment within the shortest possible time. And these are going to inform new programs at the universities.
That's the point.
New programs at the universities. So it will push off programs which are run just for certification, and rather roll out these programs that once you take on, there is a segment of the society waiting for you to come and address it like this.
And whilst you are talking, I realize that this kind of program is what artificial intelligence cannot do.
Yes, because it requires a human factor. Yeah, the human AI can develop
facilitate the template, but it will not take your work for you to make. But this one engaging. This is engaging.
Beautiful.
This young men young men who have finished school. Trust me. These things we are sharing with you, you can create several jobs out of it. You don't need to apply for any job. Go look at this and run with this. Peace of mind. Go to the net, come out with questions that you can even have a poster on internet, do a questionnaire kind of thing, peace of mind, come up with a solution to measure peace of mind.
This is serious.
This is serious.
This is serious.
This is it. So government, if you're able to measure this, it will inform us the kind of policies we need to come. Some of the policies, we don't even need money.
Exactly.
Trust me, if you're able to identify the peace of mind thing, and there's a system to create it. Some of the issues it's not by medicine.
A whole lot. Especially in our context.
In that context, no.
A whole lot. A whole lot. Yes. Yeah. So we should be thinking, as we go through the strategies, we should be thinking around the job opportunities that it also creates, because it means that this one, almost every district will be having some personnel that will be moving from one household to the other, and then using those questionnaires to assess the mental health of the district. And cumulatively, it then builds into a national program.
That's the point.
And then now you, as the government, you are able to know that out of my citizens, about 80% of them are having mental distress. It informs the kind of policies. Wow. It is just so good. It is just so good.
We want to commit to come out with some questionnaire on the peace of mind from Kingdom Economic Forum that can be used. In fact, the peace of mind questionnaire, it's not going to be generic for, it will be different. We will do one for the council, other sector institutions. Yes. The kind of question we need to ask for so we will do something. I think if you are, maybe, is it psychology, those who are doing, this falls within psychology or what?
Yes, psychology also plays
humanities.
A role, and then even
those who are doing humanities and you want to do if you're a lecturer, these are the areas you can let your first degree project work.
Very tangible.
Tangible one. Give several of them, let them go and do assessment of peace of mind. This is free advice.
A sample district. You assess it. Look at how They then present, at least with AI, so you can translate the data.
Data, it's not difficult. Just go and analyze it.
See the percentage, see it will give you even pie chart, very nice diagrams.
And what you can even do is that you can look at, after doing the assessment, we can do a ranking, the peace of mind
of the various districts. So that it shows that maybe this district ranked number one of the districts with the highest level of mental issues, or maybe highest level of peace of mind.
Peace of mind.
What is really going on there that is translating into this peace of mind?
This is a new. I'm watching my camera and I'm saying that this one is a huge academic advance. Maybe we'll come to that.
Serious? Yes.
This definitely is a new area, but so let's move on to the traditional councils. Maybe.
Yeah. So with the traditional councils, train traditional healers to record cases of emotional distress using simple logbooks, and this can be monthly because we know that our traditional healers, the frequency of engagement is high. So, and we know that most of them, or a good number of them, a bit more sometimes illiterated and co. So what we can do is, and this is also another job opportunity.
Yeah.
Where we target these traditional healers
and train them.
And then we train them. And we train them so that we help them to identify when it is a spiritual thing and then when it is a mental distress.
That's the point.
So that they can also record it in the logbook.
The logbook.
We can also
give them a template for them
a template. Yeah. So we do maybe a district level, all the traditional healers and then the herbal engagement. We put them together, run a training or a workshop for them, and help them how to identify issues of mental distress. Yeah. And then give them a template that when you record it. So it becomes part of the data we collect. Wow. And then, so now the district health management system is picking a stretch of data. Yeah. And then the traditional health system or the traditional healers are also picking its data. Yeah. And then there is a continuous system of training them, which is also boosting their practice. Wow. Moving from just the usual approach, so it does not deny the place of spiritual engagement. Sure. It only augments it.
That's the point.
So beautiful.
So beautiful.
So beautiful. Nana. So if we can move on.
Move on.
Yes. So with the private sector, we know that we said that it is the employees that drive the productivity. Yeah. So definitely if they are mentally stressed, then it will also affect their output. So here we can put in order not to handpick people, we can make it anonymous.
Anonymous, sure.
Yes. So that anonymous employee wellness service, which may have parameters of maybe sleep, peace of mind, stress, and things like that. So that one too could be run quarterly. So every quarter there is that metric, and I think that especially with this. Maybe methanol, we could take it up at the corporate level. At the corporate level. Develop. I think we have a sample, but maybe with the specifically we could add up the peace of mind, the wellness, and things like that, and then help companies. And just imagine that every quarter you are running as a company, something like this.
You mentioned about methanol. It is a consulting. As maybe give further so that people will know what we do. It's very important. Yes.
So we beyond the Kingdom Economic Forum and the New African Concepts, together we also have the Methanol Consult. Yes, consultancy and publications. And what we do is we are into leadership consultancy, corporate governance, and we focus on organizational culture. So building your organization from vision statement, mission statement, and then core values, and then how to really institute these values and then operationalize it. Because the thrust of or the success of every company rests on the culture or the values that really drives it, not just the one on the walls as core values. So this is what we do, and we'll be glad to also have that with you. So if you are listening and then you are having maybe a company, or you even now intend to start a company, we could help you build from the scratch how you can pitch your ideas well, and then also build a very solid culture to also translate your company as well.
I think another thing you didn't mention is that we do value audit.
Yes, yes. I think that's what I wanted to even connect with this one.
Maybe talk about
yes.
it. And that's the critical.
Yes. So the one connected to even the subject matter is the value audit. You know that we have auditors, but their inclination is more on the money. But now we are also, that is one unique thing about Metanoia Consult. We help you to also audit the values. So what you have on paper and what is really going on, so that we can help you through it. We can then diagnose, so that you can have the state of affairs, the real state of affairs of your company, and then based on that, we can also prescribe the way forward or things that ought to be done.
Because if your employees don't share your vision, they will steal from you.
They will steal from you.
And that is why when you do the value audit, whether the value system, the mission statement, the workers, do they really align? Because some of them or painting or
or profit graduate.
So you need to do that, because if the people is in line with your vision, they will not steal from you, and that will even give more productivity. So allow us to come and do, even within the church, the value system. What kind of value system is being. Sometimes what you have, sometimes you go there, they have mission statement and values, core values, principle. They don't understand. So we come and do that. When we do the audit for you, value audit for you, you clap for us. So we are available for you to help you.
Very well. Yeah. So that is it. So that anonymous employee wellness service that can assess the peace of mind of the people. So that if you are a job, or shall I say, if you are the owner of a company, and then so this one falls under the value audit.
Sure.
So you get to know that you have 100 workers, and then about 95 of them are saying that they are mentally stressed with the work they are doing. It is a very serious feedback, which will help you to sit back, go back to the drawing board, and then know what to do in order to. And it is a good thing if you have about 80% of them saying that we really enjoy the work we are doing. That's also a very positive feedback. So, Alex, this can also be done.
This can even be done within the church. The pastors have to do this.
Yes.
This is very important. Most of the pastors are mentally stressed.
Yes.
So there's a need for us to do that. So we are ready.
Yeah, so
we are available.
So one segment is to the members. And so for the members, then the pastors, you are not just looking at Sunday in, Sunday out. The fact that the auditorium is full.
No,
so you are okay. When you, through some of these audits, you realize that, hey, the congregation I'm dealing with, behind the smiles and the suit, behind the suit and the dance.
Praise the Lord and clapping.
There's an issue with your matters. And especially then also with the those in the ministry. The stress. It is also another area that we are very much open for as well. Yes.
Let's go to the civil society. How do we measure?
Yes, so the civil societies as well, we could use the World Health Organization. So the Wellbeing Index in all program evaluations. So that one could be limited per project. So any project we can develop they have the World Health Organization metric, and then we can employ that as well. Then I think it has connected to the faith base that we were talking about. Include one mental health question in Sunday service or Friday prayer announcement. So that one can be
weekly. It's very important.
So as we build the discipleship system, like maybe cell leaders, so we build a system that measures this aspect of their well-being every week. And I believe that you'll be surprised as a man of God. Maybe if you do the analysis by a month's time or by a quarter, you'll be able to assess that with the people that we are dealing with, this is the state of their lives.
Sure.
So that your obsession is not just about how much tithe is coming in, and the programs, everyday
attendance.
programs. It will even inform your messages for the next 3 months.
That's the point.
Because most of the messages from the pulpit, the people are disconnected.
No.
Because pressure head them the trim and they all can once.
No. Wouldn't have different route.
Greek word. The Greek word AAC. So you clap for you, but it's something else. It's something else.
Good.
Yes.
The media.
And then with the media, we can conduct call-in or SMS polls. On a scale of 1 to 10, how much peace did you have this week? Very, 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 very good. Very, very, very good. Very, very, very good. And I think even this one can be translated onto our campuses. Yes, because some of us are in today's campus beyond the academia. We deal a lot with the youth. And the level of stress and the issues that they are going through. So I believe that GES or the educational system must inculcate this, and it will be a very positive feedback for them from the basic school to the secondary school to the tertiary school level.
Talking about data. We need data.
Collecting data, and you realize that, okay, let's say Prempeh College, maybe 4,000 students. If you run this for about a whole research, and just like you said, this is what the university projects should be. So that, let's say, KNUSC, some departments are assigned to specific schools. So maybe this number of students for your project work. For the next 3 months, you are going to assess the well-being index of Prempeh students. We must do Mato, maybe OWAS, Mato, Presec.
Okay, continue.
Eduardo, it is going, and the data they will collect, present on it, proffer solutions, give recommendations. During their presentations or their defense, I was said district GES district should be there. Representatives from the GES should be there to really, and even the health directorate,
the counseling department,
the counseling department
must even lead this one. That's the work.
They should be there during some of these presentations, and they will be amazed the feedback that they are going to collect.
Listen to me. Now we have tools to analyze everything. All we need to do is to collect the data. And this now you are going to write. No. All you need to do, collect this data, and it can be done within 1 month. It's not difficult. I think we need to. If we don't do it, nobody will do it. We will take it up. Anyway, go on. Then.
So that is for the media,
and even it fits into the academia.
Okay, yes, it connects also to the academia. So validate short mental health skills for Ghanaian languages. So the standard metric can be also broken down into the local languages for our market women, the usual people who will not be able to relate with the English. And then international partners.
These are the things you are supposed to fund. The international partners.
Yes. Fund and coordinate national mental health prevalence surveys every 5 years. And it will be strong when all these institutions are playing their roles. So at the national level, you are taking data from the religious fraternity, from the district health, from the traditional healers, from the media, from the academia, and then now you program everything into a national system, and you get the actual data. And based on it, you can now roll out policies. And this is where the international bodies must be willing to fund that, okay, given this policy, it is data-driven, not just sentimental or populism. So great. So Nana, these are, but as we keep on speaking, in fact,
so many things
a lot of things keep bubbling.
This is Kingdom Economic Forum, a forum where we give solutions. These are divinely inspired solutions. Sometimes you cannot even find them in your textbooks. And we believe that when we implement it, it's going to work. Let's look at the risks and difficulties. Some of them think that the things we are talking about is not is difficult. We cannot do it. It's going to cost money. Listen to us. When the well is there, the resource will be released.
That's right.
So let's look at number one. Maybe I will mention the risks, and then you tell me the mitigation measures. Stigma prevents honest answers. When you are doing some of this well-being, for the stigma,
yes.
So what is the solution?
Just like under the private sector, we could employ that approach of making it anonymous.
Anonymous, okay.
So we could engage that approach for all institutions. Because once the confidence is there that it is anonymous, the willingness to open up and then give honest answers. Because these are to be formulated into policies. So these honest answers will also, or have big or have truth answers will also affect the policy. Yeah. So I think that once we engage it, make it use anonymous, non-clinical language. Yes. Then, so instead of mental illness, yes, peace of mind.
That's what pain. Those
mental illness is a bit of overt clinical language. So the peace of mind makes it easier for people to relate. And then also once it becomes anonymous, people can be willing to give honest answers as well.
Another risk is that self-report may be inaccurate.
Yes, so what can be done is to combine proxy indicators like sleep hours, clinic visits for stress-related illness. So that it is not just about what the person is telling us, but rather we can also track. And this leads into also, it means that we must have a very good system in terms of this IT system where the data is really connected. So we'll be able to track your engagement with maybe the hospital or any medications you may be taking for stress reliefs. And then we'll be able to also compare it with what you are telling us. So that what you are telling us compared to the various things that you are into, your medical history, it can also help us to shape it as well.
Another risk is the no budget for new surveys. We don't have the budget.
Yes, so I mean, piggyback
the government
on
will tell
existing data collection. Yeah, so what we can do is sometimes it does not require starting from the scratch. We've done a lot of data collection. We can use it as a springboard so that if we want, for instance, we have the census household surveys. These are things, and then the district health information management system. These are already operational.
So we add it to
So we can just add what they are already doing, so that instead of carving it out,
so a standalone,
which of course will be met with we don't have money, then we can write on what is already going, so that when I think the census is done every 10 years.
10 years, okay.
Yes, so we add it up to their questions. And then also we have intermittent household surveys, district health, community surveys. So we add these questions that assess the mental health to those questions that they have already. And then we then extract those ones to build our analysis.
Amazing. And then the other one is the traditional healers may resist. So how are you going to do it?
Yeah, so we could co-design tools with the associations. And it is natural once they feel involved in the process, because it's that already there is a bit of narrative concerning them. If they are just there and you bring it to them, it becomes a bit like you are as if you are a bit derogatory. So here the best form is to roll them in and then make them feel part of the process, so that at the end of the day, the template as designed becomes that, okay, it was we together with their association that prescribed it. So it is a way of showing respect and regard for their autonomy, and that it becomes partnership. With that, we can also get them involved as well.
And then the last one has to do, and when it comes to the risks and mitigation, is the media polls are not scientific.
Yes, so for the media, it is because it is the call-ins. It must be clearly labeled as non-representative. Yeah, so we use for trend awareness,
not policy.
Not policy.
Yeah.
For policy, it must be research-based.
Research-based.
Which I think that is what the academia and other institutions will be doing.
Yeah.
But at least it gives us a fair idea. It gives us a fair idea of what is really going on. And there are some kind of media polls that could be run that could not that could be as close to research as possible.
That's a point.
But we should label it well as representative.
Yeah.
And then if we want to translate into policy, we should augment it with a well-based, academic-based research to also push it. Yeah.
Brothers and sisters, friends, loved ones, fathers, mothers, this is Kingdom Economic Forum. Today, we've been able to conclude on the domain 1 of the Ghana Wellbeing Index, health as peace of mind. Listen to me. What is prevailing in our society, sometimes some of the accidents that we see, I think it has mental health issue. Some of them, the driver don't have peace of mind. So I think that even before the VIPs and all the STC, those commercial drivers must go through such a test every week.
Yes.
So this for the road safety, it just came that there's a need for them to run this test every week for these drivers so that we reduce accidents on our road. And I want to propose that even in churches, the marriage forms, we need to create a test on peace of mind before we go further. If you're a father and somebody wants to marry your daughter, let him run that test. It's very important.
Very, very, very important.
Very, very important because it has impact on all that we do. So next week, God willing, having taken much time to go through the health as a domain under the Ghana Wellbeing Index, we'll be looking at community. Oh, you cannot miss this one.
So lovely.
Community.
So lovely.
You're going to spend a lot of time to treat this community. Do we have community in Ghana? We want to look at that. And it's going to be amazing. If you're listening to me, I want to use this opportunity to invite you to Pentecost Men's Ministry. We have a special week coming on from 16th to 21st of this June. 21st June is Father's Day. And Kingdom Economic Forum is inviting you to, wherever you find yourself in Ghana, Pentecost, the Men's Ministry. In fact, I'm the Deputy Men's Director for the ministry. And that's why I'm inviting you to join us from 16th of June to 21st of June. The 21st is Father's Day. We want to invite our chiefs, opinion leaders, MPs, the president, and everyone to visit us at any location of our the Pentecost Church that we will be clamoring it with the Father's Day. We want to celebrate fathers. Maybe write a letter to your father, write a memo as a community, as a church, write to the chief, the opinion leaders who are doing very well. Do something, honor them, let's honor them. And trust me, it's going to be amazing. This year's theme is called Men Unleashed to Transform Society. In fact, as part of this celebration on the Saturday, we want to identify a challenge in our community. The men of Church of Pentecost are going to gather all men through the chiefs, the opinion leaders coming together to identify a problem in the society. It could be that you want to weed a cemetery. It could be that you want to weed a street leading to the community. Anything, the school, you want to paint the Ahimfie, that is the chief palace, paint the hospital. These are community-based projects that we are rallying all men. That's a Pentecost men that they are leading. But those activities will not be just for this program. Every month, some of you can decide to adapt a place and you'll be doing some work over there. This year is going to be beautiful. Join us. Man, the image and the glory of God. Man, be strong and courageous. Man, we are firmly established. See you and God bless you. Bye-bye.